Welcome back. Pop-up COVID-19 vaccination clinics targeting high-risk communities continue today in Overbrook. That's the ward of Councillor Ralston King. Throughout the pandemic, the councillor has spoken up about the particular needs of the most marginalized residents in our community. And Councillor King joins me now. Ralston King, thanks for joining us.
Thank you.
Councillor King, there was a pop-up COVID-19 vaccination clinic in your ward today. You were there. How did things go today on its first day?
Well, I was really gratified from everything I've heard. It went very smoothly. There were 500 vaccines that were available to community members today. It was by drop-in only, but people came early to really ensure that they had an opportunity to secure a vaccine. No appointments were required, just proof of the fact that people are Overbrook residents, because as you had noted, Overbrook is a high priority neighborhood. In fact, Overbrook is fifth overall in terms of the highest rates of COVID infection in the city after Herringate, Emerald Woods, Bayshore, and the Byward Market. So it's absolutely necessary to ensure that we have opportunities really to reach out directly to residents in high priority neighborhoods such as Overbrook. With the vaccine.
So Ralston, who were the residents who ended up showing, who were there, who showed up today? Did you have a sense as to who they were?
Well, it was a wide variety of people. So I think it ran the entire spectrum. As people might know, with in terms of my ward in Rideau Rockcliffe, we run an entire spectrum, socioeconomic, geographic, cultural. So there was a wide number of people who attended. But the key here, of course, is really ensuring that we did outreach to people who really require it, who are in high-risk groups, such as the immigrant community, the Indigenous community. We have a higher number of Black residents in Overbrook versus the city average. So the idea behind these pop-ups was to engage those communities. And so we had volunteers and other social agency members knocking on doors before this clinic, really to encourage people to take advantage of this opportunity in the neighborhood.
We know, and you've stated it, we know that your community is a hot zone when it comes to COVID-19. Should this pop-up clinic have happened sooner?
Well, we did actually have a previous pop-up clinic in Overbrook. So I'm pleased that city staff, and I've been working along with city staff, along with the Ottawa Local Immigration Partnership and Ottawa Public Health and other organizations, to really ensure that we develop a strong community-based plan for COVID-19 testing and vaccination for our high priority neighborhoods. And this type of approach really emerged out of those discussions that we had based upon community input. The clinics here really represent our efforts at trying to enhance and ensure that we have higher vaccination rates for residents in high priority neighborhoods, people who might be essential workers, who have larger families at home, where you could have greater vectors of infection throughout the neighborhood. So I'm actually quite gratified that as a strategy, we're able to start this process of rolling out pop-up vaccination clinics, not just in my ward and in this area, but aiming to do that in other hotspots across the city.
Do you have a sense of what the vaccination rate is for racialized communities in Ottawa?
We are working on those numbers. So, at the beginning of this crisis, as you might remember, I made calls to ensure that we have disaggregated data around the impact of COVID-19. And so I made those calls very early. And obviously, social service agencies as well as Ottawa Public Health were listening. And they undertook a report that demonstrated that there's obviously higher levels of infection, and it disproportionately affects Black and racialized communities. We're continuing on with that research. So I'm not aware of immediate numbers that have been published around that, but I do know that we are calling for greater statistics around measuring that, because without the data, without measuring, we can't really put into place very strong health policies. So we are going to continue to push to ensure that we do see those numbers as a continuum of that process around data.
Councillor King, moving forward, given that COVID-19 has served really to expose the economic, social, racial inequalities that already existed in our communities, what kind of systems need to be put in place to ensure the safety of our most marginalized residents?
Well, the key thing is this is demonstrating that we do need both short-term and long-term investments into our community around health supports. And obviously, in the near term, we obviously need increased vaccine supply so that we can increase mass vaccination, but also these niche vaccination approaches that we are taking in high priority communities. But in the long term, most importantly, I think that we need to ensure that our province really steps up to the plate and really invests in more support for priority neighborhoods with a full health team or community health centers within our neighborhood. So while we have a community resource center that provides social services in Ward 13 and in the Overbrook area, we don't have a full community health and resource center that would provide greater health supports.
Councillor King, we'll have to end it there, but thanks so much for joining us today. We do appreciate it.
I appreciate it.